Welcome to this presentation on COVID-19, brought to you by Connecticut AHEC Centers in the Health Forward AmeriCorps program. To start this presentation off, we're going to talk about what a virus is. A virus is a microscopic parasite that can infect living organisms and cause disease. It can make copies of itself inside another organism's cells. Viruses are able to cause many types of diseases such as polio, Ebola, and hepatitis. There are different types of coronaviruses, and these include the common cold, Middle East respiratory syndrome, and severe acute respiratory syndrome. So what exactly is COVID-19? COVID-19 is considered a novel coronavirus, which means that it was not previously identified. The virus was given its name by the World Health Organization. CO stands for corona since it's part of the coronavirus family. VI stands for virus, D stands for disease, and the 19 stands for 2019, which is when the virus was first discovered. The virus started out as an animal coronavirus and was only spread to humans if they ate that animal, but it has mutated and is now able to spread from person to person. So the big question right now is, why are we seeing a rise in cases? The answer to that is simple. As more tests are becoming available, more people are testing positive for the virus. But since not everyone is still able to get a test, the number of positive cases is still higher than what is being recorded, which is why it's so important to practice proper social distancing. So how does the virus spread? Like I mentioned before, the virus was originally linked to a live animal market. The virus was found in bats and was spread by people buying those bats from the live animal market and eating them. The virus then mutated and is now spread from person to person. In the beginning, we were able to track how someone contracted the virus, but now that the virus is more prevalent in the United States, we are in the community spread phase of the virus. This means that we are no longer able to backtrack and find out how someone contracted the virus. The virus is very contagious, and if you are infected, you are able to infect someone else. The virus is spread by respiratory droplets. A respiratory droplet is produced when you breathe, cough, sneeze, or talk. This is why it is extremely important that if you absolutely need to leave the house, you are wearing some sort of face mask. In Connecticut, the governor has issued an executive order requiring cloth face masks to be worn in any public place where you cannot practice social distancing. It has been found that the disease can now spread even just by talking to someone who is infected. If everyone wears a mask when in public, then everyone is protected. Another important note is that it is estimated that 80% of people are asymptomatic, meaning that they have the virus in their system, but they are either showing very mild symptoms or no symptoms at all. This is another reason why it's important that you wear a mask if you leave the house. It is not only protecting yourself, but the others around you if you are asymptomatic. Here's an example of how fast the virus can spread. You have the virus and you go and talk to your mom. She's now infected. Then you go and see your friend and they are now infected too. You decide you need to take a trip to the grocery store and you are not wearing a mask. You see Morgan Freeman and are excited to talk to him because he's your favorite actor. You just infected Morgan Freeman with the virus. You check out at the grocery store and infect the cashier on your way out. And then you go and drop some food off to your cousin and infect them. Now everyone who is in contact with those people will also be infected. This is how community spread of the virus works. If you come in contact with someone who's infected with COVID-19, your symptoms will appear 2 to 14 days after you are exposed. The most common symptoms are fever, cough, and shortness of breath. If you experience these symptoms together, please call your doctor and request to have a test done. If you test positive for the virus, you will have to go into isolation. Isolation is used to separate sick people from healthy people to prevent the spread of disease. People who are in isolation should stay home. In the home, anyone sick should separate themselves from others by staying in a specific sick bedroom or space and using a different bathroom if possible. If that is not possible, it is important to disinfect that bathroom every time the person uses it. A member of the Department of Public Health for the entire state of Connecticut will be in contact with you and will monitor your symptoms daily. Once you are fever-free without the use of Tylenol and are no longer showing any symptoms, including a cough, you will be allowed to leave isolation. So who are the at-risk populations? Anyone ages 65 or older are at risk. Other groups that are at risk include people who have lung disease or asthma, people with various heart conditions, the immunocompromised, people who are severely obese, people with diabetes, anyone undergoing dialysis, people with liver disease, and anyone who smokes or uses any kind of vape. So how can you protect yourself and your family? Avoid close contact with anyone who is sick. Make sure you are staying at least 6 feet apart and practicing proper social distancing protocols at all times when out in public. If you are sick, stay home. Cover your coughs and sneezes with a tissue and throw that tissue away immediately. Clean and disinfect frequently used surfaces and objects in your house at least once a day, and follow the governor's executive order and use a cloth face mask whenever you are in public. Other ways to protect yourself is make sure you wash your hands often for at least 20 seconds with soap and water, especially when you come back in the house after sneezing or coughing, going to the bathroom, and before touching your food. This is the best way to protect yourself. If you don't have soap and water available, make sure you are using a hand sanitizer that is at least 60% alcohol based. All information in this PowerPoint came directly from either the CDC or the World Health Organization. Also included is a COVID-19 fact sheet that was put together by medical students across the country. It includes information for all age groups and in multiple languages. Please go to those 3 websites to get the most up-to-date information on COVID-19. If you need information about resources that are available to you and your family, you can call the Connecticut 211 number at any time. On the next slide, there will be a link that will lead to a Google form. Please make sure to fill out that survey and also use that form to ask any questions you still might have about COVID-19. A question and answer sheet will be emailed to your teacher after this presentation, answering all remaining questions. Here is a link to the Google survey. Please make sure to fill this out when you are done with your presentation. The link will also be in the email sent out by your teacher. This presentation was created by Central Connecticut Health Education Center, Incorporated, in collaboration with Southwestern CT Health Education Center. Changes or edits to this presentation are not allowed without the express authorization of Central AHEC.